Hi everyone, my name is Dr. Mansi Jani. I am an international board certified lactation consultant, infant and young child feeding counselor at Apollo Hospitals, Navi Mumbai. In today's session, I will be discussing about a few common breastfeeding related challenges and how to overcome them. Breastfeeding is natural and instinctive, but it may not be easy for every new mother. It is a skill which requires right support and guidance, especially in the early days after delivery. And if a new mom receives the correct guidance, she may be able to walk past any breastfeeding challenge that may come her way. In my clinical practice of over 10 years, I have observed that these challenges arise from both maternal aspect and the newborn aspect. So in today's session, I will be covering all the maternal related challenges, that is from the mother's side, what all challenges can occur and how we can overcome them. The first and the most common challenge I would like to talk about is related to the nipple issue. Nipples can be flat, inverted nipples. And if a new mom is having a flat and inverted nipple just at the time of delivery, there may be issues in latching the baby correctly onto the breast. So it is advisable that breastfeeding should be initiated in the first hour of birth, as baby's sucking reflex is also very strong in the first hour of birth. So baby may be able to latch onto the breast even if it's a flat nipple or an inverted nipple. Once after delivery, new mom, you can get into a comfortable position and get guidance on latching the baby correctly onto the breast. So that when baby correctly catches onto the breast, baby's lips are wide open, baby's chin and nose is completely touching the breast. In this way, we can ensure the nipple and the surrounding areola, the dark tissue, goes deep inside the mouth and baby latches on well to the breast. What happens during an inverted and flat nipple latch is the breast tissue, it slips out of the baby's mouth. So when a baby is latched correct, deep with a wide mouth onto the breast, baby can stay onto the breast for a longer period of time. If the latching is not correct, if baby is latched shallow onto the breast, if baby is not caught onto the breast well, it may gradually lead to soreness of the nipples, like painful nipples. While breastfeeding, you would get pain, crack or bleeding nipples, which is really discomforting. It may also invite more infections onto your breast. So therefore, it is really recommended to get correct guidance and go for a wide, deep mouth latching onto the breast. This is your answer to correct all your breastfeeding related issues which may arise from the nipple related aspect. Also, if you are having nipple pain, soreness or any discomfort, you can apply ice packs. After the breastfeeding session, you can apply a cold towel or an ice pack or cold cabbage leaves. You can apply your own milk. Your own milk has lots of healing properties. So even that can be applied onto a painful nipple or a cracked nipple. If it is too much discomforting for you to latch baby onto the breast, you can avoid latching the baby for few sessions and you can try to express the milk out through hand or with a pump. That expressed milk can be given to the baby with the help of spoon. And once your healing process has started, once you are recovering from the cracked nipple or a bleeding nipple, you can start latching baby in the correct method with the wide mouth and the lips wide open. So the correct latching will prevent all your further nipple injuries or nipple cracks. Next, I would like to talk about is a milk related issue. Even this is a common issue encountered by new moms, low milk supply, even oversupply or leaking breasts. So both the aspects are to be considered. Low milk supply occurs when baby is not frequently attached onto the breast. That means baby is not frequently emptying the breast. Milk remains collected inside the breast. Breast gives signal to your brain that more milk is not required because milk is staying inside the breast. That leads to low supply. To increase the supply, best and most important aspect is to put the baby onto the breast frequently, every 2 hours in comfortable positions, so that baby can latch frequently and baby can drain out more milk from the breast. As more milk is released, your breast will get signals to produce more milk. So more milk removal makes more milk. So to overcome low milk supply, You feed frequently. You put the child onto the breast frequently, including night times. milk production is more during the night times. So especially at night time, when babies are frequently asking for feeds, put the child onto the breast. That will help you to build up a good supply. In cases of oversupply or leaking breasts, it is common in the early days because your breast in the early days has no idea of how much milk to prepare for the baby, like how much milk will be required for the baby. As baby breastfeeds frequently, baby gives signals to your body, baby gives demand to your body to produce the milk, and that's how your breast gets calibrated and your breast prepares the exact amount of milk required for baby. So leaking and oversupply would eventually come to a normal milk supply, provided that we are frequently breastfeeding the baby in the correct techniques and the good latch. That will help you to prevent the further oversupply or leaking of breast, as it can be very discomforting. To manage oversupply, choose comfortable positions. Laid back positions, side-lying positions are really helpful to manage the fast flow of the milk. And it is advised to follow longer feeding sessions on one side, so that one breast gets completely emptied and then you can switch over to the next breast, and that's how your breast understands how much milk is required for a baby, and it will then come down to a normal supply. So that's how we can manage oversupply and leaking breast. You can also wear comfortable nursing pads inside your clothes to prevent excessive leaking and clothes wetting. Next common issue I would like to talk about is breast engorgement. This also happens in the early days. In the first 3 days after birth, you are having little milk supply. It is the first milk, colostrum. From the first day onwards, as baby starts breastfeeding, your body gets signal from baby of how to prepare milk, how much milk is required for the baby. If baby is not attached frequently onto the breast, or if baby is not latched correctly onto the breast, when the milk is not drained out properly, milk stays inside, it leads to engorgement, pain, heaviness in the breasts, redness and swelling. It is really discomforting. The answer to overcome breast engorgement is you can apply ice packs. Every second or third hourly ice packs can be applied, and to correctly latch onto the breast. Breastfeeding needs to be continued. We cannot halt the breastfeeding there due to engorgement. Breastfeeding needs to be continued. Baby needs to latch in the correct wide mouth latching technique, so that baby catches nipple and areola and drains out the milk which is collected inside the breast to ease out the pressure from inside and so that the mother feels comfortable. If breast latching is not possible, if the discomfort is too much, so much so that you cannot take the baby onto the breast, then pumping is a good option. Applying ice pack and pumping out every 2 hourly. You can use a breast pump, electric pump or a manual pump. Try to express out the milk. If pumping is also discomforting, breast massaging with the help of your hands and hand milk, you can express milk through your hands. Manual milk expression is also a great way to release milk out from the breast and to prevent further pain and further discomforts. So engorgement also happens in the early days, and if breastfed frequently in the correct techniques, all the excessive collected milk will release out from the breast and your breast will become soft and we can control the engorgement. What happens if the engorgement is not controlled? This is also a common issue faced by the new mothers. If the engorgement is not controlled, it may further on lead to clogging of the ducts. One of the milk ducts may get clogged and milk may get collected, it may remain collected inside the breast, and it will also feel lumpy, painful inside the breast in any aspect of the breast. That is also really discomforting, and to release the clogged breast, it is also again advised baby to be correctly latched onto the breast and frequently given breastfeeding. It is important to choose correct positioning according to the place of the duct where the duct is clogged. To make sure that you are giving the latching correctly, is chin needs to be placed in the direction of the clogged duct. That helps the baby to completely drain out the milk from that duct. And as the duct unclogs, as the milk releases from the breast, you would again feel soft and comfortable onto the breast. You can apply hot packs frequently. Every third hourly hot packs can be applied to release the clog, along with breast massaging. massaging therapy onto the breast to release the clog and to ease out the flow of the milk from the breast. If the clogged duct is also not corrected, as the engorgement may lead to clogged duct, if the clogged duct is also not corrected, it may form a milk blister or a milk bleb onto your nipple. It's like a white spot onto your nipple. It is painful, really hurting while breastfeeding, and the surrounding dark area also feels really tender, painful and sore. The answer to overcome this milk blister is to frequently allow baby to suck onto the breast in a correct manner, so that with the sucking pressure, the blister may release and the milk will start flowing out. It will ease you out from the pressure, and apply a warm water cloth like a hot water towel or warm water cloth frequently onto your nipple, so that the skin becomes softened and the milk can be released. The plug can be opened and the milk can be released easily. If the milk blister or the clogged duct is also not corrected rightly, it may lead to mastitis. It is an overall inflammation of the breast, but it is associated with infection. Because the milk stays inside, it may lead to a bacterial infection inside the breast and it may cause mastitis. You may require to visit your gynecologist to examine yourself and be treated with the correct antibiotics for this. How to understand if it is mastitis? Your breasts will be tightened, hard, painful, swelling with lumps, without lumps, but redness would be persistent. And you would also feel flu-like symptoms like body ache, fever, headache, tiredness. You may not be able to take care of the child properly. All these things are related to the infection in the breast. Wait for the infection to reduce and then you can again resume breastfeeding. Also, if mastitis is not corrected, it may lead to a further more dangerous complication known as breast abscess. It is a lump inside the breast, but the lump is filled with pus. It's a pus-filled cavity. Really painful, really hurting for you, and it requires surgical procedure to remove all the lumps and the pus fluid amount which is collected inside the breast. It is really not suitable to develop a breast abscess or a mastitis after you've delivered a baby. You require many antibiotics and you need to go through a lot of procedure to help overcome with that. So the best guidance here is to latch your baby correctly onto the breast and feed frequently. Watch for your baby's signals. Do not watch the clock. Your baby will give you hunger signals. Your baby will give you signals that I am full. Watch the child. 24 hours. Put baby onto the breast frequently and monitor baby's urine and stool output. If baby is passing urine more than 8 times in 24 hours and passing stools 2-3 times in 24 hours is a good enough indicator in itself that you are producing milk well and baby is feeding well. In your frequent follow-up visits with your pediatrician, you would also notice the baby's weight is coming, baby is growing and developing well. So these are good enough indicators for us to understand, for you to understand that baby is gaining well from the breast, baby is getting good breast milk supply. All these challenges can be overcome by understanding a simple concept of demand and supply. The more you put the child onto the breast, the more baby drinks milk from the breast and you will produce more milk. That's how you can continue to feed smoothly. Important thing to remember here is correct techniques of latching and positioning. That is a challenge in the early days. If you do not receive the guidance of how to hold baby, how to latch baby correctly, how to make sure baby catches a wide mouth with the chin and nose touching the breast, lips wide open, and baby getting a deep latch onto the breast. If you do not receive this correct guidance, get in touch with lactation consultant. Get in touch with us. We can guide you how to position your baby correctly onto the breast, how to prevent all these breastfeeding related challenges, especially in the early days. Once you have developed this challenge, it is twice more harder for you to overcome it. We can therefore correct it in the early stage, in the very early stage, right after your delivery. So I urge you all to get in touch with your gynecologist, get in touch with us, take a lactation consultation and overcome all your breastfeeding related challenges. Go ahead with a smooth breastfeeding journey for you and baby. Thank you all for watching. Upcoming video would be on baby-related factors which leads to breastfeeding challenges. So stay tuned. Thank you. Bye.